I first knew I wanted to be a doctor actually in early high school, and I specifically wanted to be a neurosurgeon from that time. What interests me about operating on the brain and the spine is just the anatomy is amazing, and the ability to actually go in and correct structural problems and help a person who may be paralyzed, and get him walking again, or be threatened with death and keep him alive. Those things, it's just an amazing experience and career to have. The vast majority of patients I take care of are spinal patients with back pain or pain in an arm or leg that results from herniated discs of the spine or some structural problem in the spine that's pinching a nerve, or the spine itself may be unstable and require to be reconstructed. Many patients show up who are afraid of surgery and have certainly heard out in the public that you should never have your spine operated on, but they're in severe pain, and that pain is an impressive driving factor in their decision-making process. But we always offer the full variety of treatment options to a patient, short of surgery: physical therapy, chiropractic, pain medicines, pain management, things of that nature. They're always an option for a patient whose pain hasn't yet gotten to the point to decide surgery. However, if their problem is threatening to them as far as physical performance, then we may strongly encourage that decision just to preserve their function. Normal pressure hydrocephalus is a diagnosis that a lot of patients get because they start losing their balance, they have forgetfulness, and maybe lack of control of their urination. And sometimes, after everything else is considered, we find that they have fluid buildup on the brain, and then we do testing to determine if that fluid buildup might be out of the range of normal for their age. In that case, they can be established with a diagnosis of normal pressure hydrocephalus. And the treatment for that is to put a shunt in and to divert that brain fluid to a different space in the body so that the brain doesn't remain under pressure from it or have what we consider an abnormal environment of fluid dynamics. It's a common diagnosis locally because of the age range of our patients. It's more typical in patients 60 or over. Surgery is always held off as a last resort if there are other alternatives to treat the patient that might reach the success you're looking for or the goals you're looking for in treating that problem. The surgical success rates are extremely high, especially if the diagnosis is very discrete and well-defined and the surgical option is available for it that's a perfect match. Those success rates can be as high as 98, 99%. So there's the success rate of spine surgery at Blake Hospital, I think, parallels or exceeds the overall success rate of spine surgery that's accepted in the United States as a standard. There's many ways a patient can establish confidence in the surgeon that they've been referred to make a decision to let that surgeon take care of them. One is simply by word of mouth in the public if a surgeon's been in the town long enough. The second, hopefully they have confidence in their referring physician, having had a history of referring patients to that surgeon. And third, I think it's a fair question to ask your surgeon, how many of these surgeries do you do? And that's pretty important. The staff at Blake Hospital is amazing. They've been around a long time. There's a lot of people who have been, that I've seen taking care of our spine surgery patients for many, many years, and they're very experienced and very adept at the issues that might arise in the management of those patients. And they have a private suite with a ratio of nurse to patient care that exceeds the average in I think, most American hospitals. And they have a very good experience. The feedback I get from patients at Blake is that they have an excellent experience here despite what can be a very traumatic experience physically.